some of our biggest beauty blemishes, freckles and moles, and they're making a mark on all of us.
Indeed they are, but our next guest is a doctor who specializes in living frecklessly. With us is dermatologist Dr. Michael Shapiro, and he's going to tell us all about moles and freckles and how we can get rid of them. Welcome, Doc.
Thanks for coming back.
Thank you so much.
Tell us a little bit about the formation of moles and freckles and sunspots. How do they come about?
You're born with certain genetic predisposition to getting moles and freckles, and then how much sun you get predisposes you to getting more. So as parents, if you try to avoid excessive sun exposure in your children, they'll likely get less moles, less freckles.
And you brought a couple of patients with you today who are going to have freckles removed and moles removed as well. When should people start to get a little nervous or think that something's different if they start developing freckles or moles on different parts of their body?
If a mole is new or if it's changing, then you should at least show it to a dermatologist or to your family physician. Freckles are a normal thing that people get on sun-exposed areas of their face, their backs of their hands, their upper back. What you want to look out for with freckles is that they're uniform in color. So a normal freckle, we all know, is a light brown color. So if that's the case, then it's fine. If you see a freckle that has several colors in it, then you got to wonder whether it's really a freckle or something else.
Got it.
And part of the reason we're going to do the procedure right here on the show is to show people that it's fairly simple to get these removed, both freckles and moles.
The removal of a mole usually is a minor surgical procedure where the skin is anesthetized and then the mole is removed. It could be done superficially where it just heals on its own, or you can remove the root. Freckles, you can also remove them with minor surgery, which is what we're going to do today, or you can lightly burn them with liquid nitrogen, which is it's called cryotherapy. You can also do chemical peels. You can also do lightening creams such as hydroquinone creams, kojic acid, retinol creams. And then you can also laser it with Fraxel and other lasers.
Wow. So let's get started with patient number 1 here. She's going to have some freckles removed. So what are you going to do to her?
So her freckle actually is a little bit raised, so we're actually going to also remove it surgically. So we're going to give her a little anesthesia. We're actually going to do that for both patients today.
Okay.
And just very, very superficially remove it.
And Rebecca, why did you want to have this removed on your neck?
Over the years, it seemed to have grown a little bit, and it concerned me at first, so I approached the doctor and asked if it was something that I should be concerned about. He said likely not, but I asked if it should be biopsied or not. He said, why don't we take care of it? I'll determine if it should be biopsied. And so I figured I would come and he would take care of it.
All right. Well, Dr. Shapiro, take care of it. Let's
get to it.
So what we do first is we just clean the area with a little bit of an alcohol swab. In an office setting, usually the patient would be reclined to some degree.
Okay.
And then we anesthetize the area. It feels like a tiny pinch.
And you said this procedure basically is a matter of minutes.
Yep. It actually is a matter of seconds.
Rebecca's not wincing or anything,
I know.
which I take as a really good sign.
I actually didn't feel it at all.
Really?
I was waiting. Nothing.
I'm fine with getting shots. Needles going into other people freak me out.
Yeah.
So obviously not, but obviously not a problem.
Both ways. I'm usually on the floor.
And then we take a sterile surgical blade. And then remove it.
Really, that's all there is to it?
Yep.
And it's gone. Look at that.
Wow.
Holy cow. No, Rebecca, what did you feel? Anything?
Yeah.
No, I really didn't. I felt a little pressure at the end, but I thought that was him pushing on it, and then he said it was done. So
is there going to be any recovery from this? Like, does she have to do anything different? Just watch where they are?
I probably have to take the rest of the day off, right?
Absolutely.
Yeah, go home, lay in bed,
Call
watch
your
TV.
boss, yeah.
So she just, we apply a medicine so it doesn't bleed, and then she applies a little bit of, we usually give Aquaphor, which is Vaseline, to the area for a couple of days. But she can shower, she can get it wet.
Wow.
And all that good
It's just
stuff.
that easy.
Done and done.
All right, Lacey, that's our freckle. Lacey, you've got a mole that you're going to get removed. Where is it and what? Were you concerned about it?
It's on the side of my face.
Oh, look at that. Yeah, there it is.
And it has grown a little bit, mostly after having my daughter. During pregnancy, it grew a little bit. Not really nervous about it, but it's on my face, so.
Yeah.
And it's better safe than sorry having moles removed because hereditary things.
Now, how are you with needles?
I'm fine with needles, so
Nice.
I'm ready.
All right, let's get
Anything
to it.
different in this procedure?
So when you remove a mole, you want to make sure to figure out whether it's going to leave any color behind. If moles are darker, if you're removing them the way I just did for Rebecca, the there's a chance that there'll be a little bit of color at the base. You can remove that color later by using one stitch, but if you can avoid it, it's better. So for Lacey's mole, it's a light brown to begin with, so it'll probably heal perfectly.
Right.
In terms of what you said about the pregnancy bringing out the mole, that's very common. Pregnancy, in pregnancy, you can get moles getting darker, getting a little bit raised. And the fact that a mole gets raised in and of itself doesn't really mean anything, as long as the mole itself looks okay.
But always better to check it out and be safe than sorry, right? All right, so let's get to it.
Let's go.
It's a very similar process.
Have you had that all your life, Lacey?
Yes.
Really? So this will be, cosmetically speaking, this will be a change. You look in the mirror, you're going to see something different. Yeah, exciting.
So again, you start with a little bit of
lidocaine.
Lidocaine, okay.
And we clean the area.
Now again, recovery time, is she going to have to do anything differently? No makeup for a while?
So she can actually apply makeup normally. Again, she should put a little bit of the Vaseline, the Aquaphor on first, and then she could apply makeup over it. You're feeling a little bit of pressure and a little stinging.
Again.
No wincing, no cries of pain. This is a good sign.
You guys are pros.
It was like nothing.
And the most important thing on the face when you're removing these, especially if you're not removing the root, is to do it so that it's flush with the surrounding skin.
Right. Is there a point at which there's a chance that a mole would grow back, or you'd have a recurrence in the same spot?
There is, but it's small, and if it happens, you could just repeat the process. Right.
But if you take the root, does that mean it's not going to come back, or?
Correct.
Okay.
But the problem is that if you take the root, usually you have to apply one stitch, and if you do that, and just hold that right there. If you do that, then you have to place a stitch, and a stitch can sometimes leave a mark.
Right.
The good thing on the face is that even stitching leaves very little mark because things heal very well on the face.
Yeah.
How did that go? Did you feel anything?
I didn't even feel...
Hey, we just chatted our way right through your procedure, and it's gone. It's totally
and you're
gone.
done.
Wow, you just sort of peeled it off her face like a piece of candy.
Fantastic. Dr. Shapiro, thank you so much for showing us those amazing and really painless procedures.
Oh, it was my pleasure. Thank you.
And to our patients, too, we appreciate your bravery in coming on and doing this. Stay with us. We'll be right back.